welcome to How to Talk to Your Patients About Circumcision. I've got some amazing women here, and we're just going to get into it. So, Jen, do you want to start?
Sure.
Okay.
My name's Jen DeJamis, and I am a childbirth educator. I was certified through CAPA, I don't know, like 10-something years ago. Can't remember when exactly, but I just keep recertifying. And I also have volunteered for Intact Michigan and Peaceful Parenting for almost as long. So I was the director of Intact Michigan for quite a long time. I'm not actively doing that anymore, but I still give these talks when I'm requested to do so.
Thank you.
No problem. So yes, I have lots of materials to share with you today, but I really didn't want it to be so much me lecturing, but more of like a conversation, because it's important for everyone to like get their questions answered, and that's really the best way to do that. You know, sharing the experiences that you've had so far with talking to your clients about this, and maybe thinking ahead about how you'd like to talk to them in the future, and maybe answer some questions that you didn't know you even had as we're covering some of the material.
And that's why I called it a roundtable discussion. It's because I thought I just want to see, what do other people say? What is your experience? How are things going out in the field for you?
Okay. Yeah. So I just wanted to give you a couple of things to take home with you. This sheet, that's a packet, I guess. It's like 3 pages long. On the left side is a client discussion checklist, and this literally walks through every possible thing that someone would need to know to make an informed decision about circumcision. So it starts out with like, okay, do they understand the anatomy and physiology of the foreskin? Because if you're going to cut it off, like, you should probably know what that was when your kid asks. You know, because they will. They become autonomous human beings, and they have a lot of questions about that as they start to go through changes and start to notice that other people have something they don't have, things like that. So the next section is explain the self-protective and immunological and sexual function of the foreskin. We'll go over this in more detail. I just want to hit the highlights. Explain proper intact care. So, you know, if you're going through this conversation with some people, they may not have already decided to circumcise. So the next question is, well, how do I take care of it? How do I teach my kid to take care of it? So explaining proper intact care is like a natural second question. And then explaining circumcision is something that you have to do anyway. And I can go over that in a little bit in more detail, the different types of procedures. Explaining pain relief is important, especially if your client decides that they are going to do it. There is a discussion to be had about how to ethically do circumcision, and you know, pain relief is a big part of that. And then the risks of circumcision, we can go over that too. Benefits, I put that here in quotes because, well, the benefits are really kind of up to the person who's deciding to do it. Like, they have it up in their mind that there may be benefits, and you can talk about those in more detail.
Well, and that's another thing that I come up against a lot is, like, basically I don't want to come across as vigilant. Like, oh my God, you're considering circumcision? In my mind, I feel that way.
Right.
In my heart, I feel like if I could only explain to you properly, there's no way you would make this decision.
Right.
But I don't want them to feel as though,
like, they're being
just
attacked.
such a pressure.
Yeah.
Most of the reasons why I feel like clients, they go, well, Dad has it.
Yeah.
They want to look. I want them to look like Dad. I'm like, because I'm like you. I feel the same way. I'm like, okay, it's your choice. I'll support you in your choice, but your reasoning is just.
I feel like a lot of them wouldn't even say that if they knew what their partner was missing. Right. Do you know what I mean?
Yeah.
And there's some cognitive dissonance there. Like, they don't want to know what they're missing. The partners don't want to know what they're missing. So part of the reason they want their child circumcised is so that they don't have to confront the fact that they may be missing something. You know, it's like, I don't have to deal with that if my kid doesn't have it. I don't even need to think about it.
I tell people, you know, in the 10 years that my son's been around, him and my husband have never compared penises. You know, so not come up. Like, it just
Same. Yep. I've got 2 boys, and my husband. When we had this conversation, I knew from the get-go that it wasn't going to happen.
Okay.
So I was like, but okay, we'll go there. We'll just do our own research. You do yours, and I'll do mine, and then we'll like regroup. And he came back and said, it's not medically necessary, so we don't have to do it.
Okay.
I was like, thank you. I'm glad I don't have to have that argument, but so many people do, and it's really hard. I mean, it really can put a lot of stress on a relationship at such a delicate time, when they're expecting.
But that probably is why sometimes mothers who would prefer not to circumcise,
They just do it anyway.
Right.
I hear a lot of, I read like on Facebook and mom groups. Well, I don't want to do it, but my husband, I'm having a son, he's a male, so I'm having him make the choice.
Yeah, that's what I've heard that a lot.
It's not my choice. It's not, I don't know, I'm not a male, so I'm not choosing it. I'm making the choice.
There's one argument for saying, hey, I have intact genitals. I'm assuming you weren't circumcised at birth, or you weren't. I mean, some women have been, so, I can't assume that about everybody, but generally speaking, most women in the United States have not been circumcised. And female circumcision is usually the removal of the clitoral hood, and it's for cultural and religious practices. So, but generally speaking, women do have their intact genitals, so, like, you could say to that client or that person, you could advocate for your child to keep all of their genitals because you have all of yours. You know what it's like to have all the parts that you were born with. You
got to keep all of yourself.
Right.
And the thing that you said about autonomous, I say, we're in the age of consent now. We didn't even even my generation, I'm 42, 3, wasn't really, we didn't talk about consent as a child. But my children's generation now, everyone talks about a consent at a young age. So now, again, how are you going to explain to your 5-year-old, and obviously as they age, who knows, 10, 15, how are you going to explain to your son why you made that choice for them? That seems like really intense to make that choice for a newborn.
And my oldest child is 19 now. She's in college, and she shares with me the conversations that college students are having. They're sexually active, they're talking about other people's stuff, and it is very much an accepting culture of whatever you're bringing. You know what I mean? Like, it's kind of it's a cultural melting pot when you go to college too. Like, there's people coming from all over the world. She goes to Michigan State, and there's people coming from lots of different countries, and people are getting together with people from foreign countries, and it's just not a big deal. They don't even think that foreskin is like weird or anything. They're just like, okay, I guess you better learn how to put a condom on it. You know what I mean? So, and then this other handout that I put in here is kind of like something I would copy and give to my clients, and it just goes over, instead of talking about just what circumcision is, it talks about what foreskin is first, and like how it is a functional organ and how it protects the baby in several ways. It covers the urethra, which is a vulnerable opening to the body, just like other orifices, the mouth, the ears. The urethra has a pathway for infections and pathogens and has its own built-in immune properties. From birth, the foreskin is fused to the glans, which is the head of the penis, by a membrane called the balanopreputial lamina. This prevents the foreskin from retracting until later in a boy's development. The sphincter action of the foreskin's opening is what allows urine to exit as needed while preventing pathogens from entering. Second, the foreskin houses lysozyme, which is the same substance found in mother's milk and tears that is a natural form of protection from pathogens like bacillus and streptococcus. Additionally, if a child is breastfed, the oligosaccharides contained in his mother's milk also play a role in preventing infection via the urethra. Third, the foreskin protects the glands during a child's growth and development. The head of the penis is meant to be an internalized organ. The tissue of the glands is similar in texture and color to the interior of the mouth. When it is permanently exposed, it dries out and begins to keratinize, essentially creating a callus on what is supposed to be a supple, moist, and sensitive part of the body. When the boy has sexually matured by the age of 18, the foreskin continues to protect the urethra, maintain moisture and sensitivity of the glands, and provides a smooth gliding action during intercourse. This allows for moving pressure stimulation for his partner versus friction stimulation, which can cause micro tears in the tissue that opens the way for infection, burning, pain, and or discomfort during or post-coitus.
And that's for him or her.
Yes.
Yeah.
If you look, I have these amazing crochet penises.
Oh, I thought you were about to crochet yourself. That's what you were to do.
So this just is to demonstrate a foreskin the way it retracts.
Uh-huh.
And like this is when the penis is in the vagina or somewhere else.
Wherever it is.
It glides back and forth versus rubbing.
It makes total sense. Like
Yeah.
when I was reading that, I was like, that makes sense.
Yeah.
So less friction for both people, like you said.
Mm-hmm. So less lube
Yeah.
and less problems. So
Got off her eye.
when I was going through all my stuff, I'm like, oh yeah, I forgot about these. I was really happy.
Now I feel like I'm at a sex toy party.
It's crochet, so maybe not the best. I wouldn't use it for anything else. So I like to go over at least that part of it with my client so that they understand, like, it's not just a flap of skin.
Mm-hmm.
Like, there's way more to it than that. And then, maybe they start to ask more questions about, well, other than protecting, what else? I mean, is there anything else to it? Mm-hmm. And then you can start talking about how the nerves, there's like a lot more sensitivity in the foreskin than there is in the glands. And there is actually like this, I gotta see if I can find it. Here it is. Circumcision removes the 5 most sensitive parts of the penis. Yikes.
I mean, just to play, devil's, like, it seems like men enjoy it enough.
Yes. Then they'll say, well, I don't think I could handle it if it was more sensitive.
Right.
Oh.
Well, yes, you could. Like, women have all their genitals, and they're not like going out of their minds from orgasms. Like, you know what I mean? It doesn't make sense.
Yeah, interesting.
So this just shows the sensitivity between an intact and circumcised penis, and this is the research that it comes from. And the red is the most sensitive. And you can see that there's basically nothing left except for this frenulum here. That's where the foreskin was attached before circumcision. And so, like, a lot of that purple is missing. That is, like, the second most sensitive area. So the glands, the yellow part, is the least sensitive. And you know, during intercourse, most people think it's the most. Mm-hmm. It's really that underside where the foreskin had been attached that's the most sensitive for a circumcised person. So that's more science to throw at people when they're asking about those types of things. Here's another. These are just showing the different parts, comparing the intact to circumcised. So like these 3, the most sensitive parts of the intact penis are gone on a circumcised penis.
I guess just for me, this way of explaining it doesn't like make me feel like, oh, I want to save their sensitivity. Like what does this get at for people to say this is important to preserve, do you think?
Well, when you think about, I mean, just when in doubt, switch genders of the child you're talking about.
Oh yeah.
You know what I mean? If
Yeah.
you were talking about a female, because people are a lot more heightened to their sensitivity around like female genital mutilation. Mm-hmm. So if you just compare it to, okay, I mean, now imagine doing it to a girl.
Yeah.
How does that change your perspective?
Yeah.
So it's really that, like, we still live in a cutting culture. We live in a culture that has totally normalized this, doing this routinely to young baby boys, and we have to sort of take take that cultural lens off.
Well, and so that's what I say to people. I say, I don't think we should make medical decisions based on cultural norms. You really need to see this is a medical decision that has medical risk.
Yes,
and so
it
you
does.
have to know that it really has nothing to do with your culture. I mean, I get that it does. I don't say that to people, but like that's where I struggle with how to really communicate this. I did the same thing with my husband. First of all, I didn't even think about it. If I would have had a son first, I'm sure he would have been circumcised. My husband's Jewish. I didn't even think about it. No one talked to me about it. No one said, oh, since you don't know, are you considering, I had a doula. So, thankfully I had her first, and then I became a birth doula and postpartum doula and learned all about it. So for the second, I did the same thing. I gave him the literature. And he said, he's like, I'm Reformed Jew. Like, I don't follow all the rules. And he was like, I don't see this as a rule that makes any sense. And so I don't want to follow it. So I was fortunate enough to have that same.
Yes.
To have that same result. Yes.
Yeah.
I had that conversation with my mother. I'm Jewish as well. And before I found out her gender, she goes, well, it's a boy. We have to schedule the bris 8 days after he's born. I'm like, Mom, he's not being circumcised if it's a boy. And she goes, then he can't be Jewish. I'm like, okay, then he can't be Jewish. Like, why are you going with that threat? I'm like, and I tried to explain to her why I didn't want to circumcise. She goes, well, I don't agree. And I'm like, okay, you don't have to agree.
Right.
No, my son now goes to temple, and they're learning about, I don't know, whatever they were on at the time, and I heard that was going to be brought up, and I pulled them aside, I said, I just want you to know that my son is intact, and so when you discuss this, I don't want you to just assume that everyone's circumcised, and he didn't know what intact meant. He was like, intact.
Whoa.
So,
Don't be fussy.
I think
There's
that
that.
also talking about it in the way of like it's an organ. I think that it's not just like you said a piece of skin and kind of just because some people are factual. Now I haven't had a client that is Jewish or like has had that be like a really big reason for doing a circumcision, but I think talking to my types of clients, like it's an actual organ, and like that first paragraph of all the things that it does, and like I feel like that spoke volumes to me. I was grateful to have a daughter and not have to make that decision, honestly. Like I was like, phew, one less thing to worry about. But yeah, I think the organ angle is really good.
yeah, I like that too.
I like the comparing. If you had a girl, would you do that to a girl?
Yeah, I never thought about that.
I think that's a good way to
Shift gears.
because I think a lot, like you said, it's like we live in a culture where it's like, oh, just automatically go ahead in the hospital, baby's born, just go right ahead. So
Well,
I
and I
think-
remember even, again, my daughter's 14, and my mom was like, so you're going to pierce her ears? And I was like, no, I'm going to wait till she wants to pierce her ears. Those are her ears. I don't get to pierce them, you know? And so I think it's the same thing, but there are plenty of people still piercing their baby's ears at 2 months old or however, you know.
I had mine pierced at 2 months old. Culturally, that's what we did, and I've thought about doing. I think I told you this before, but I thought I always assumed I would pierce my daughter's ears, and then she ended up being born and having to go to the NICU and stuff. So I was like, you got poked and prodded so many times without anyone asking for permission. I'm not doing the ears. So yeah, I like that too about the consent, and you're gonna have to essentially answer your child's questions someday. How do you feel about that? Like,
I waited till my daughter asked, but it wasn't because I thought about what you're saying. It was because I don't do needles. My ears are not pierced. So I'm like, if she asks for her ears to be pierced, her ears will be pierced. And otherwise, they will not. So she was about 10.
I mean, you could take it to a lot of extremes, you know, that whole argument of, well, I mean, you could talk about like vaccines, like, you know what I mean? There's like a whole additional like conversation that could happen beyond that, but I just try to bring it back to like, okay, you're actually removing a body part here.
Yeah, well, this
That's
can't
how
be
it's different. Yeah.
reversed. That's
Right.
what I've said to people. I said, you know, if you're unsure, you can always wait.
Yeah.
Because this can't be reversed, and if you feel like the pressure to decide in the first 5 days of having your newborn, it's too much.
Well, and it's just like, I mean, your emotions are all over the place.
yeah. And
Those
I don't
first
know,
few days.
I don't know about I feel like Michigan, I always heard like the circumcisions were done in hospital, like baby's born, maybe 24 hours later they're getting the circumcision before they even go home.
Yep.
And while I practiced in Florida, it was much more frequent. I don't think I remember maybe one or two that even talked about happening within that 24-hour mark. They would go to the pediatrician and then schedule outside of that. So they had a little bit more time. That's what I was more used to than Michigan.
Well, they don't do them at U of M, do they?
Yes.
The OBs don't.
Okay, they
It's-
don't.
no,
well,
it's
you know,
the
I said
pediatricians.
yes. I think I make an assumption.
Yeah.
Okay,
It's the
'cause I-
pediatricians that will do it, and there was like some change. It was quite a few years ago that they switched it.
And it's around the 24-hour mark, isn't it? Or it is the date when they're going home,
Yeah.
if I remember correctly.
And
So-
is it ideal for it to be done by pediatric urologists if they do it, or do they not do them?
It's ideally done by a pediatric urologist, and
'Cause
those aren't the ones that roll up and do them.
So few and far
The
between,
hospital.
too hard to find probably.
Yeah,
I think
if they're a
that's specialty,
specialist,
yeah.
so you have to make an
But they
appointment.
do, what would the word be, fixes to ones that
Yes,
have gone wrong,
they
right?
do.
Oh.
I've seen those websites that they're like, my whole job is to fix
Thoroughly
circumcision gone
done.
wrong.
Yeah.
Oh.
How common is
Yeah.
that?
They just said 1
Way
in
more common
500
than you
in
would
here
think.
have issues. I don't know exactly what they are, but
A lot of babies have adhesions because now the circumcisions that they do are like more loose. So like they're not taking as much foreskin as they used to because the baby has to grow into their foreskin.
It
So
can like be too taut if it's done.
yes, if they
wrong,
cut
too.
too much, it can, and like if it's done like uneven, it gets like exaggerated as they grow. So like a little tiny tilt turns into something much more exaggerated as they
I
grow.
see. Okay.
So they just take like not as little as they can, but
Okay.
less than they used to.
they take less than they used to. So that's why adhesions are a lot more common now because there's more skin that can reattach itself, and it's just trying to heal itself. Really, it's just trying to cover up the glands again, and like assume the state that it was in
Yeah.
before.
well, and that reminds me of the cognitive dissonance thing. I mean, people don't want to put whatever the eye ointment on. Like meanwhile they're willing to do this. I feel like people get uptight about the wrong things sometimes.
Well, maybe it's kind of hard to make generalizations because if we're talking about like one specific person making this decision for their child, like they have a set of beliefs and a set of assumptions, and you kind of have to like parse out where this is coming from. Some of them will just say, it's my partner, that's what they want to do, and I don't want to argue with them or whatever. Some of them, I mean, I've met moms who are the ones that really want it done. And like, if you dig a little deeper, it's like, oh, well, you had a brother who had, a problem with his foreskin or something,
Yeah.
they've got some reason, or maybe they had an old boyfriend who had issues with theirs, like chronic infections or something like that, and that's another conversation. But there's usually something that they're using to justify this decision and not having to research it further.
The people I found the most who actually have, well, I don't know if they've researched it, but they've got more lived experience is like ER docs and nurses who see a lot of elderly men with chronic infections.
Yeah.
And so I've talked to a few nurses, like, 'cause what I usually say is, have you done any research on circumcision? And that is my way of saying, not what do you feel, what did your dad do, what did your brother do, but
Right.
have you actually looked into it? And let's start there, and let's just start talking about. And I know a few over the years is mostly in the medical field. And, those people I found, nurses and doctors, carry their own level of trauma from seeing sick people all day and also feeling as though the body is like seeing always people whose bodies don't work properly. You know what I mean?
Right. Well, it's a bias.
Bias. Thank you. That's the word I was looking for.
Yep. A bias where the assumption is that
it's all going to go wrong.
yes, there is dysfunction
Yeah.
inherent to
Yeah.
having a foreskin. And actually, I'm glad you mentioned that because a lot of older men had their foreskins forcibly retract when they were children.
Oh, wow.
So they've got scar tissue that they're dealing with just because that was the advice, was to force them. I remember my mom. I asked my mom after my first son was born, "Hey, like, how do I take care of this thing?" You know, and she's like, "Oh, you're just supposed to pull it back and clean it up." I'm like, and like I tried to do that. I'm like, I just don't see how I can do this without hurting him.
Yeah.
So like, I ain't gonna do that.
Yeah.
And I'm glad I didn't. But that was the advice for the longest time. And you will still hear that advice too. Like, oh, you got to keep it clean. You got to pull it back to clean it.
Yeah.
And that is not true at all. It is a self-cleaning oven, just like our vaginas. So those men have had trauma, and their foreskin doesn't function like probably somebody who didn't have trauma.
Yeah, sure.
So that would be one reason why they could be having like chronic infections and probably have some adhesions that are, mucking things up.
Sure.
I think sometimes too people have like the decision fatigue, and they just especially like if the birthing person is the one making all the choices, and then it's like a male father or male partner, and they're like, he can just make that one. I don't want to even think about it because they've made every other choice too.
Right.
Stuff like that can happen.
I think during those 9 months, the amount of going from we just got married and we had to choose our linens to like this type of stuff, vaccines, circumcision, it feels really heavy.
Yeah.
Now that our kids are older, like now I realize, we make these type of heavy decisions all the time, and I've gotten used to it. It's not so like anxiety provoking. But I think, when because you go from being, I think, before having children, obviously everyone has different personalities, but to being pretty much in control of a lot of things. And then afterwards, that breaks open, like, you lost control. They're nuts.
There's no such thing as control.
Yeah, and I think the weight of like somebody outside of me, like before when I was pregnant, I'm feeding myself and knowing what's going in, all of that kind of stuff, and then you don't know how they're going to feel, or like, and who they're even going to be when they're, like, my daughter's 3, so I think sometimes I look at her and I'm like, who are you going to be at 12 or 18? Like, you just have no idea.
Nope.
You can try to mold or,
They don't seem that
do
much
stuff.
different to me. Like my kids are in their teens, and I'm like, oh, you're just a big version of the little you. They're like, stop it, Mom.
That's cute. I love it.
You had mentioned the whole, like, the medical thing, and I have a circumcision consent form that I thought we would take a look at. One of my nurse friends was able to acquire this for me, and she highlighted the important points. So they don't actually walk you through the whole process of informed consent when they're having you consent to circumcision. You know how they're supposed to do the whole, like, benefits, risks, alternative, blah, blah, blah. They don't do that. So it's when they're signing this, the parent is basically saying, I've done all that research. And the medical professionals at the hospital, they can wash their hands of that problem, if there's any risk, if any risks turn out to be something that happens to your kid. So you're just saying, by signing this, I am making an informed decision. There's no guarantees, promises, or assurances that have been made to me about the results that may be obtained. Like, come on. If they're not going to walk you through those things, you shouldn't have to ask. You know what I mean? Like, they should be doing those things, just like they do for, like, birth interventions. They should be talking you through that stuff. And it is an ethical duty of theirs to do that, but they don't, usually. So,
Well, and that's the problem, is people just sign things without reading them.
Oh, yeah.
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 It just stinks that they're supposed to do that and they don't, and then people sign it.
I wonder if it's like, because, they're just standing there waiting for you to sign it, right?
Oh, yeah.
So maybe if you're like, you can take your time with that, just like you would for your client in labor who's being faced with maybe having to augment their getting an induction or getting augmentation or something like that. Like you tell them, ask for some time to make this decision. Well, why wouldn't you do the same thing for this?
Well, and that's why I say you can always do it later. Is that really accurate? Am I is that true that people are having their children circumcised later?
Some of them are, especially people who are really trying to protect the breastfeeding experience. So they'll delay the circumcision until breastfeeding's been established, and then they'll have, they'll make an appointment with a pediatric urologist, or there is a help me out here, a Moyle that will come to the house to do it. And he will even do it for people who are not practicing Jews.
Okay.
He's an MD too. So.
Well, let's talk about the breastfeeding relationship then, because that should be a big thing for most women.
Well,
if they know.
Yeah, I think it's been a little bit cleansed from some of the La Leche League. And
I'd like to hear about it. I'm going to refill my drink, but I don't really know the connection between the two.
Yeah. Go get yourself a
Okay.
We'll go to.
We'll take a little pause.
Do you want anything?
I will go over there in a minute when she's done.
I will wash my hands and hold her when you do that.
Perfect. Yeah, I have to breastfeed weird because she has a tie. And I did a release, and the dentist who did the release didn't do a full release.
On purpose?
So how is that
He didn't know.
Why is it still posterior attached or something? Or?
Under her tongue. She had a severe lip one and a severe tongue one. So she still has tissue. So she clicks, and if I let go, she can't hold on. So she's getting it redone.
Okay.
On the 16th.
That's no fun.
No, I'm not very happy about it.
With the same guy? Or?
No.
Yeah.
No. You
refer to Kelly Gira? She's like a dentist that specializes in it.
Okay. We're going to Ann Arbor Pediatric Dentistry in Chelsea. That's where my lactation consultant told me to go.
Oh, good.
So
here's some more cards that you guys can take to keep in.
So how do we talk to a client that's already brought up circumcision, and you kind of just
Well, you could say there's a few things you could do. Are they decided?
They want to circumcise, but they're trying to figure out how. I think a pediatric urologist is your best bet. I wouldn't have someone do it in the hospital. They're pretty set. They want a circumcision, but
so if they're definitely set on it, then
let it go.
The thing you want to do is prevent trauma to the baby.
Okay.
So they need the best pain management that they can get, which is actually if you go in that handout that I gave you.
Yep, I did see there was not effective.
It talks about the different ones and how whether they're effective or not. The most
so
common,
docs will be using stuff that's not even.
Yeah, they'll just use a numbing gel sometimes. They won't even do a nerve block or something, anything like that. Sometimes they only give them sugar water.
Oh my gosh.
Which is insane to
me.
My
mom was trying to be well, at least when they're Jewish, they get some wine. I'm like, that doesn't. What is that going to do?
Yeah, not really.
She goes, at least they're drunk and they don't really feel it. I go, that doesn't make me feel any better on the decision.
I know.
Yeah.
Alcohol runs in the family, Mom. I don't really want them to be drunk at 5 days old. That's how I feel about it.
Yeah. So the dorsal penile nerve block is. That's the best one you can get in the hospital. Sometimes they'll do a ring block. It's either the DPNB or a ring block.
It's a needle?
Yes. The ring block is they do 4 injections all the way around.
And I would say more
and then
advanced,
the
progressive.
DPNB is dorsal. Is that top or the bottom?
I don't remember.
Top.
All right, let me go wash my hands.
Top.
Fish went
top.
Okay.
Dorsal. Top.
So the dorsal penile nerve block would then be an injection on the top of the penis near the where
that
they
sounds
would cut.
painful in itself. I don't.
Yeah.
Yeah.
Even when my kids get vaccines, I don't like them screaming from the shots. I I personally just couldn't watch that happen and then watch you snip off a piece of anatomy on my child. I just couldn't do it.
Yeah.
It's with my daughter being in the NICU. She had was born with a congenital heart defect, so she went to the PICU, and they had to do one of those tiny PIC
lines.
Yeah, the PIC lines. And the nurses actually told us to leave. We're going to give her morphine. She's going to be fine. You guys have to leave for this one. And then the next time it came out, and they had to redo it, and the nurse was like, you're going to leave in a little bit, so I'll just do a regular line. And I had to be in, I was in there. I didn't have to be, but I was in there, and I was holding my little baby's arm, and like watching that happen was like, I'm crying. I'm like, it's okay. They need to do this. You know, like she needed to get that medicine. So,
Right.
But being present for that, because I thought I had heard that for some circumcisions, one of the parents can be present. Is that not true?
Yeah, I think it's mostly a hospital policy whether they'll let them be there or not.
I feel like if you're there.
I've heard of some places that allow it and some places that don't.
Okay.
They usually don't want the mom there.
Oh, really?
Real.
Wow. I mean,
Wonder
yeah.
why.
Your cells are connected. You know, you feel all the stuff that they're feeling.
Oh,
That's how it is when you're Jewish. Your moms can't be in the room. They kick them out of the room. They have, I think, like 7 to 8 men in the room.
Yeah, I went to a breast
like-
once. It was
But the moms, no females are allowed in there. The mom
Really?
is not allowed in there. She's like kicked out. She can't not be in there.
no females, period.
Good. Okay, I'm gonna eat. So
Trying
you're
to-
she's
I'm
good.
trying to nurse.
She's always trying to nurse. I love her.
She says, I'm trying to grow. I got things
She's like,
to
I'm
do.
trying to fall asleep and I can't sleep. She doesn't take a pacifier.
Okay.
here's a Brit Shalom. You can do a Brit Shalom instead of a Brit Milah.
Perfect.
It's a peaceful naming ceremony.
We did that for her. Aww, she had her naming ceremony.
Oh, that's great.
And I was telling them she had a severe lip tie.
I remember you posted it.
And then the tongue one was released, but they didn't do a full tongue release. He missed a bunch of tissue. I'm not happy about it. Trust me, I'm not happy about it. So that's why you saw me holding on, because if I let go, she can't hold on.
Oh.
So that's why she can't take a pacifier, because it can't stay in her mouth, because she can't. She has no muscle in her tongue to hold it in her mouth.
Good boy. No.
So that's why she likes
like,
to just comfort
Looking
nurse.
for a boob.
I know. Can I hold the pacifier in her mouth, or you don't want her to?
I don't have one.
Okay.
A clean pinky?
I did just clean off, but I don't know if you want me to do that.
She won't like it.
Yeah.
She's like, what is that?
I had to put my fingers in her mouth a lot after her procedure.
Oh,
So she
it's a
doesn't
little-
like, it's like
yeah.
trauma for her when I put my hands in her mouth. She doesn't like it.
So
I'm just eating really fast, so I'll take her. Then I'll just breastfeed her.
this is like a whole job description for the residents. You have to like observe one,
One.
do one, and then teach one circumcisions. That's part of the training.
One and one and one.
Well,
And then you're
probably
done?
more than that.
That's spooky.
Yeah.
But this is so a lot of circumcisions are performed by people who have no experience performing circumcisions. It's basically what I'm trying to say.
That's not.
And there isn't like a dotted line. You don't know where to cut. You're just kind of,
And every penis is so different.
yep.
Yep. For sure.
These chocolates are so good.
Ooh,
The peanut butter
chocolate.
Oh my
cups.
gosh, those are
Score
from
some of
Trader
that later.
Joe's.
Wow.
And there's like 8 or 10 of them in a package, and it's $1.
What?
Do not share that information.
I was just thinking.
Oh, thank you. I appreciate you not sharing that.
I'm like, I can't.
I did not hear that.
I'm only going to go get a couple. Yeah, okay.
I would eat the whole bag in one sitting.
By the time I got home.
Yeah.
See.
So I have circumcision tools.
Oh my goodness.
This is the one that gets used most frequently. It's called a Gomco, and it does like the clamping.
Oh, Lordy.
Yeah. They have
How would
to
it work?
show you. Should have brought it.
Do not tell me that. I don't want to hear this part of it.
So
Okay.
So this is like the little bell that goes over They have to separate the foreskin from the glands, and then they insert this under the foreskin on top of the glands, like this little hat.
Okay.
And then they pull the foreskin up around this bell. Then they put this clamp on and tighten it. So you can imagine the foreskin is pulled up right here.
Oh my goodness.
And then they clamp it down, and they have to leave it like that for a few minutes to like stop the bleeding. Oops, I think I'm screwing this the wrong way. Yeah.
Maybe this is what we need to have. Maybe this would just show this to a woman. There's no way she would agree to that.
Yeah. I can't get it back together right now. But so the foreskin is pulled up here around this bell, and they leave it like that for a few minutes till the bleeding stops, and then they cut around this bell. Release the clamp, bandage it up with like gobs of Vaseline,
And is there like, depending on the age of the, obviously the baby, so if people wait versus like if it's a 24-year-old or a baby, 24-hour-old baby, do they, what kind of like pain medication do they use? Can they use any, like, or is it, you said it's just like a local anesthetic?
sometimes they only use sugar water.
What is sugar water going to do?
Just a distraction. Yeah.
What does it do when people use it for gas? Nothing.
There's a topical one that really doesn't, just like imagine going to the dentist, them putting only topical stuff on your tooth and then drilling on it.
Yeah.
Like, that wouldn't do so much. And then I was talking earlier about this dorsal penile nerve block.
Okay.
That's the more common one in the hospitals. Like if they really care about making sure this baby doesn't feel pain, they'll do that. There's also something called a ring block, which is more effective because there is, I'm trying to remember, there's like this one nerve that is present in like 25% of males that if they get only the DPNB, it may not numb this one nerve for like a quarter of the boys. So this dorsal penile nerve block isn't going to be effective for every baby. Plus, we know that anesthesia isn't effective for everyone all the time either, just generally speaking. So this ring block puts it, there's like 4 shots at the base of the penis, and that is supposed to be the most effective.
Well, for someone who doesn't have pierced ears,
Yeah.
I just cannot even imagine.
Yeah. Then this Plastibell is like something that came out more recently than these other tools, and trying to remember what the cell was. It was some people think this is like less cutting, they say, which I guess technically it is less cutting, but they still have to separate the foreskin from the glands, which is like the most painful part. And then the cutting away of the foreskin doesn't happen like it does with this. They just tie a string around it right here, let's snap off this handle part, and then the baby wears this plastic ring until that tissue necrotizes and falls off. So it takes 5 to 7 days for that.
It's kind of like the belly button.
Yeah.
Yeah, that's what made me think.
Yeah. So, but there's a increased risk of infection, obviously.
It's so
with
long,
that.
yeah.
There's it even comes with a string.
Yeah, like, I don't think a string sounds any better. I feel like I would rather a scalpel, very quick, maybe, and like.
Yeah. Well, I mean, think about it. You've got dying, necrotizing tissue in a diaper full of poop and pee.
Yeah.
It seems like you're just asking for problems.
Yeah.
And then sometimes that plastic ring will get buried or embedded under the remaining foreskin. So that's a whole nother
Now,
issue.
one thing my patients have asked is why isn't my doctor talk to me about this? And I remember the last time I ran into a doctor who was pregnant, I totally was like, "Can I talk to you about this?" And she basically said, "We're taught also that it's cultural, and we just let them make the choice." I said, "This doesn't make any sense to me. It's a medical situation that you guys are performing, and they should need to know the risks." And wasn't it the American Academy of Pediatrics that said there's no medical reason
Yeah.
to do it?
Well, there there was some research that they cited that it reduced the incidence of like UTIs in babies up to 6 months old, which I think it was like such a small amount.
A lifelong decision for 6 months.
Yeah, it was such a small risk reduction that it was like negligible.
And I remember this doctor was like, yeah, I guess it does make sense what you're saying to me, that like we should be talking to people about it. It just seems so weird. What other medical decision are they like, why don't you talk to your grandma and come back to us or whatever, you know, like not giving them any, I don't know. Do you have any?
I think they just take a very hands-off approach to it because they don't want to be perceived to have bias on the issue. And
but they're not that way about anything else. They're like so
I know
pro medication, surgery, vaccine, like they're willing to take bias and.
Well, it is profitable to doctors and hospitals to perform circumcisions and to do revisions.
Yeah.
So it's like, you know, are you biting the hand that feeds you if you speak out against circumcision as a doctor?
Yeah.
You're like, it's like an ecosystem, you know what I mean? Like if you're not feeding it, like.
But even, I'm not even saying you have to speak out, but speak at all. Like,
right.
There's just literally no conversation, and it just seems so weird to me.
It's a hard conversation. I mean, think about how hard it is for us.
Honestly, as a doula too, I find it hard to talk. Before I really chatted with you that day, I was like, yeah, I kind of like literally avoid it. Like I'll mention it, and like, and if you're having a you know, having to make that decision, I'll send you resources. So like, I'll go do research, but I don't really like. I'll hold space if they want to talk about it, but because I did not know all of this, and I feel like I wasn't really taught it in my training, really anything about circumcision. In all honesty, even in my childbirth education courses. So yeah, this is very helpful. I think, and I will spread the good news. But it is. I think there's part of it where I'm like, I don't want to be perceived as like being that lady who's like, don't circumcise your child. Yeah, but like I think that's why I like the fact that this is science. This is an organ. This is what the tissue actually, you know,
why
is
it's
for.
there.
Yeah. And then you guys, you know, take that and if you have more questions,
I
we
usually
can talk
support
further.
Whatever their decision is. It's their decision.
Yeah.
And then I'll give them information what they do with it.
Sure.
It's not my baby.
Yeah.
Yeah, it's such a hard thing to come at, like, if you don't know what their reasons are for doing it. So it's like good to have the conversation with the, you know, if it's a couple, like having them both engaged in it, because you know, you can start to see like the looks that they shoot back and forth at each other, like, you know, like you can see that they have some
when they have
disagreement.
a little more knowledge about like, okay, wait, I didn't know that. You know, I said yes, but I didn't know that.
Right.
And it can open their conversation up too. Maybe neither one of them has really put a lot of thought into it, and so they were just going to go like, well, so my family did, so that's what I'm going to do. But maybe this just opens it up.
Well, that's the thing, is even like, I mean, this is a total another controversial topic, but even like vaccine injury, I've had a lot of patients over the years that have had vaccine injury, and they do all of this repair, and their child becomes way more high functioning, and you know, so you can't recover from everything, but you can never take this back. And for me, it just feels so like final.
Yeah, you know? For sure.
So.
There's, and I don't recommend bringing this up to clients, but I mean, there are men who have committed suicide because of their genital injuries.
The guy who ran the, do you know who I'm talking about? There was like a guy who was in his early 20s who was he was on the board of some like intact.
Are you talking about Jonathan Conte?
I think so.
Yeah,
that name sounds familiar.
Yeah.
What was he on? Do you remember?
He was involved with, it was a group in...
No Circ? Was it that one?
Well, I mean, I have, like, demonstrated with him in Washington, D.C., and he was with a group called Bay Area Intactivists.
Okay.
And, you know, they're in San Diego, and he was, once he learned the harms that came to him, and he learned very young, like in his teen years, he confronted his parents about it, and they absolutely took no accountability whatsoever about, you know, for having made this decision. And he's like, you violated my autonomy by making this decision for me. And they did not meet him where he was at. They didn't give him anything, they didn't
apologize.
They didn't acknowledge his
like,
pain.
Yeah.
And so he kind of like just went on a personal crusade to like inform people. He would ride his bike around, San Diego with the signs, and he was really active for a number of years. And then there was like this movement that came out that he actually he participated in, and then it just kind of took a life of its own after he decided he didn't want to be involved with it anymore. It was Bloodstained Men. Have you ever seen Bloodstained Men?
Wow.
They're a little radical, and that's why he decided he didn't really want to be involved with it anymore. But like, there are still people that will, like, out in front of Troy Beaumont, there's a protest every year,
Really?
September, where you'll see the Bloodstained Men out there. So, but he instead of saying committed suicide, they say something.
Died by suicide.
He unalived himself.
Oh, okay.
Unalived. I've never heard that.
Yeah, and he did that.
think it's
His
social
partner
media.
found him. He had planned it out methodically and like knew exactly what he was doing. It
But
was not.
essentially, he experienced PTSD from it.
Oh
is what
yes,
happened. Yeah.
definitely.
Yeah.
And he was so passionate. Like when we would be out on the lawn at the Capitol in DC and like talking to people and educating them and answering their questions. And it was really a lot of kids that were there on their like school tours and stuff. And foreigners would come and be like, why do Americans do this? It's, like they just didn't get it, why we were even there. And these kids would come by and they were very, very curious and interested. And some of them were like, gosh, I don't even know if I am circumcised. Like they
Didn't know what it was.
They had no idea. Like their parents don't talk to them about that stuff. I mean, it's not like when they grow up, okay, kid, we're going to have a talk about what we did to your penis. You know what I mean? Like nobody wants to talk about that.
It seems like when you start talking about sex with your children, you should.
But a lot of people are not comfortable talking to their kid about sex at all.
No.
So I think the last
Still
thing they're going to do
happening?
is...
People talk
Oh,
about
yeah.
Yes,
I think
it's still
so.
happening.
Yeah.
God.
Yes.
Yeah. People are like, it's taboo or masturbation, things like that. They're like, oh, no. Like, I don't know. It's an interesting world, but...
Wow.
The longer talks that I do for like expectant parents or that I've done in past, we talk about how circumcision is actually tied to the puritanical practices of like the Victorian era when what's his name, Kellogg, the guy that invented cornflakes.
that's why he made that cereal, right?
Yeah.
To not have people masturbate.
Yes.
Really?
So
Wait
bland.
a minute.
So bland.
It was like
You
to
wouldn't
lead
wanna
a
rub it
pure
out.
life. You eat bland food.
I've done both. I
And-
had a cereal.
Yeah,
just had
this is a
cereal.
combo here. Okay.
But he advocated for circumcising boys who were like 5 or 6 and starting to explore how things work down there, and like they touch themselves a lot as they're starting to develop more.
Yeah.
And that's when he said they needed to be circumcised with no pain management, so that the pain impression basically he's like they need to have PTSD from this, so they associate masturbating with pain, so they don't do it anymore.
That's like an erection with pain, because if they're 5 or 6, they're probably getting like small erections.
Right.
Yeah, wow.
Yep. And that's how it became like not a religious practice here. It was a cultural movement started during that time.
Well, and isn't there some group of people that believe heightened circumcision or like rates of circumcision actually some can correlate with rates of like rape of women and different things? I've heard
I
that
don't know.
before.
I haven't seen anything.
I've heard like
familiar with that.
you traumatize a man based on his penis at a young age. It's not gonna end well. Like like obviously so many men wouldn't do that, but like it could be some sort of I don't know.
That reminds me of a quote from Marilyn Milos, who was the founder of No Circ. She said, "Circumcision is when sex and violence first meet."
Oh,
Yeah. I know. So I have lots of cards and things that you're welcome to take some of, to pass on to clients. There's a couple in here that are pretty graphic.
So do you think for doulas, like, do you guys meet, bless you, like usually twice pre-birth?
I do one prenatal. And then if they're going to do postpartum hours, I'll do a postpartum planning meeting.
Oh, but then it's in the childbirth education where they're really meant to kind of...
Yeah, ideally, like we have an interventions checklist that I bring to all the clients, so we'll talk about like the, options that come up in like pre-labor and da-da-da-da, more of like the medical jargon, and we touch on what all of them are, like the interventions may be and what it's entailed. But I feel like I would add this portion to the end, like towards the end when we start talking about postpartum procedures and like this, because we kind of have like a little snippet on there right now with like resources on it. But I think at least going into that, like what the organ is, just so that it'd start opening the conversation for the couple to have. But yeah, I think I could add that on. It's a 3-hour meeting. We'll just make it 3.5.
Right. There's another place where, because I used to teach childbirth classes too, there's another place that you can have that conversation too, and it's during like newborn care, diaper care.
Oh yeah.
And I had a slide that I talked about diaper care for girls, diaper care for intact boys, and diaper care for circumcised boys. And when you compare those two, like right next to each other, they can see that there's a significantly more amount of care that goes into caring for a circumcised baby.
Yep, that's a good point.
Yeah, I mean, when my daughter got her earrings done at 10, they got infected.
Yeah.
I was like glad she didn't do this when she was super young. It's just... Okay, so doulas definitely... Is this covered in childbirth education generally?
I think it's kind of up to the instructor most times, whether
I'm
they cover
lean
it or not.
towards probably not.
Yeah,
I don't
think it really
understand.
is.
Why is this the black sheep of the discussion topic?
Oh, I'll tell you why.
Why?
So I used to teach at Center for the Childbearing Year, and this was like before I got certified, so I was still kind of in my training wheels.
Yeah.
And so I taught a couple of classes, and most of the clientele there were patients at U of M, and also sometimes happened to be actual physicians at U of M. So I had a number of physicians in my class, and my boss gave me some latitude when it came to teaching about vaccines and circumcision. So I, of course, did what I could do to like provide as much information as possible. And I was new, so I was probably a little bit passionate about it. Whatever, sue me. And there were some complaints. There were complaints from the doctors that were in my class about like having an agenda. So I was asked to like tone it down, but I did tone it down. And then the second group that I had, the group that I had after that, I'm sure I taught more than that, but the group that I had after that still complained. And I did not go gonzo that time. I was just like, this is what you should know. Like, I feel like it was very much an effect of the cognitive dissonance that they have probably from doing
I was going to say they
circumcision.
have to do it, yeah.
Like, they're like, oh my gosh, I did that to a baby like at least 3 or 4 times, if they weren't doing it regularly anyway. So it's just so ingrained in our culture that it's like you're just going to find pockets of people that get it, and a lot of people that are oblivious.
Yeah.
And that doesn't even cross their mind.
Yeah, I think that because it's like a decision you have to live with. So like to sit there and sit with the fact that like you made that decision, or like you have to make the decision. It feels so big. People get really sensitive. Like
I have a friend who regrets it, and not based on anything I've told her. She just knows more now, and it's like, when we've talked to her, she's like, I really regret doing that. She's like, that's devastating.
Yeah.
Yeah, I have a number of friends that actually my hairdresser, and it makes me a little sad because when she was pregnant with her first son, I was very much out about this, but I didn't say anything to her because it was somebody that I had a personal relationship with, and I didn't want to like damage that.
Yeah.
So I didn't say anything to her with her first son, who she had circumcised, and then by the time she had her second son, I was like, you know, fuck it,
Go for
I'm
it.
just gonna say it.
Yeah.
And she was like, why didn't you tell me? She was heartbroken that she did that to her first son. And it wasn't, she turned just like that, like immediately as soon as she realized, you know, some basic information.
I have another friend who has one each. They're 3 years apart, both boys. First one is, second one isn't.
Yep.
So,
But I'm like, you know what? You know better, you do better.
Yeah.
That's what parenting is all
Every day,
about.
yeah.
Like,
yeah.
you learn the hard way a lot of times. So, yeah. So I won't make that mistake again. I tell everybody, I'm like, oh, you got a baby in there? Let me talk to you.
Yeah.
So.
I know. I saw it too. Yeah, I know.
So tired. Doesn't want to miss anything.
Aw.
She's like trying to turn around and look at everybody.
I'll do it and she'll get me upset. Yeah.
It's time.
My daughter had a witching hour, dude.
We're in it right now.
Yeah. And it is. It's like there's nothing you can do. They're crying.
Nope.
You're doing this,
Crying,
and
they're
that's
crying.
it. That's all you can do.
And then they hit their time and they go to sleep.
Yep. We
One
did
of my
like the
clients
gas
didn't
drops,
know
all
that
the
her baby
things.
had
I'm
a
like,
witching hour because she
I don't
wore
know. The witching
earplugs.
hour is.
Like our first
My mom's
baby
like, call the
was
pediatrician. Go, she's
super
fine. She's a
easy.
normal baby. What do
Yeah.
you want me to do?
Yeah.
They're going to tell me she's
Walking on
fine.
the island, he
They
was
get out of
screaming
it.
and she was like,
You just make it tough, man.
is that what he
Parents
does?
forget. You know?
Yeah.
Katie, he's
Also,
the
I
baby.
remember
She was like,
when I had my daughter,
does it
and I
bother
said
you that he's
something about,
crying? I
like,
said, Katie, if you have
oh,
a
my
doula in
grandma
your house
goes,
and
oh, you
crying
should
baby
give her,
bothers them, you should
what
put
are
them
those
in.
gas drops?
I said,
Or like
stop.
sugar water. Oh, you
About
should
a
give her
quarter
gripe
to-
water.
Grape, yeah.
And like I ran out of the room crying.
just
and
go
I,
back
and I was like,
upstairs.
what's going on? Like,
Okay.
what? Everybody else know what to do. I don't know what to do.
Oh.
And then we look up gripe water and realize it's
Just all that
sugar.
hormones.
I'm like,
you
oh, I'm
know,
not
you
gonna
get
give
so-
that
Yeah,
to
she had
her.
anxiety with the second one too. We had a whole
I did all
scenario
the things.
over
I was like, I don't know
But
what
we
I'm
got
doing.
through it
But
just perfectly.
my mom stayed with us
She
for like
said
3 weeks. I was really lucky
few
after
weeks.
her NICU stay.
And after
And
we
when she
identified,
left,
she was like,
I
think
cried.
the meds
I was
kicked
like,
in.
and I we're not
I'm
very
a
close.
repeat,
Like,
so
we
we're
had a
like
very
family. Now I'm
tumultuous
like, you
relationship.
think they kicked in?
This is
They
like-
kicked
I'm
in.
just like,
Okay.
I was like, please
She
stay.
would
Don't go
question
anywhere. This will be
saying,
forever.
Are you gonna keep coming? Okay. Yes, Katie.
Yeah,
I want to say one
Single
more
mom
thing
doing it.
before. It looks
I'm
like we
like,
got an hour.
Mom, just come
recorded.
over every night.
Oh,
Come
wow.
over.
that's right,
I need
yeah.
a shower.
Yeah.
She's going. She can cry. No, she can't cry. I don't want